Growing chronic disease burden due to the increase in aging population.
I'm Anastasia Andreeva.
I'm Tiffany Cheek.
Anna Gordon.
Sarah Martin.
Stephen Opoku.
And I'm Justice Holstein. So a little bit of background on a chronic disease. A chronic disease is a serious illness that affects majority of the population. Most common types of chronic disease are cancer, heart disease, arthritis, asthma. Nearly 67% of the population have or will have in the future some sort of chronic disease. Next slide, please. A few problems that we can address definitely revolve around the burdens of chronic illness. They're becoming overwhelming, not only for patients and healthcare providers, but also the families of patients, the government, the nonprofit organizations. This leads to these companies feeling overworked, underappreciated, burnt out, and overall depressed. Looking at the patients are becoming stressed out due to money problems. They're getting stressed out because it's affecting their ability to work. And they're also being depressed because they feel like their life is not where they would like it to be. Next slide, please. So who is affected? A few of the affected would be governments, patients, organizations, media, and of course, the list could go on, right? But one that I really want to focus on are the families of the affected. They have to deal with a lot. They have to take a lot on. So it's important to remember that. Here on the right, we can see a graph of the average chronic disease prevalence, and down in the south to the East Coast is the most prevalence for chronic disease. Next slide, please.
Medicare and AARP are taking the biggest financial hit with covering the geriatric community's medical bills. Of the 4.3 trillion that the US spends every year on on insurance spending, 75% of all the spending is due to chronic illness. Illnesses cost about 2.5 trillion a year. On the side over here is a list of chronic conditions, and this is what a disease costs the insurance company per year. The unfortunate outcome of a chronic disease is premature death. Worldwide, 41 million people are dying due to complications from a chronic illness, and in the US alone, 1.7 million are dying every year due to a chronic illness. On the side here is a list of the top 5 deadliest illnesses, and without taking the necessary precautions, the number will keep rising.
Root causes analysis. We came up with a few factors here, but we mainly want to focus on the geriatric training. We also have a current issue where there's a low of healthcare workers, and we need to hire more healthcare workers and equip them with, skill set. And next slide, please. Critics of the problem. We also came up with a few reasons to what some of these critics are. And the main focus here is we want to focus on making our elderly community a priority first basis. And in the next slide, we will discuss the key holders and the stakeholders and the leaders of our community that can help with this problem. Next slide, please.
Chiquita Brooks LaJour is the main face official for Medicare and Medicaid. She focuses on policies and finances and trying to find a balance with collaborative leadership. Next slide, please. Here are some of the positive and negative aspects of her career. Positive, she's addressed Congress about cinching in the gaps for Medicare. She supports lowering prescription costs so that it will help low-income geriatric populations. She likes to lead with collaborative theory, bringing other leaders together to accomplish goals. Negatives would be that she's voiced her concern over Medicare reimbursement spending, wanting to lower costs, and this may leave more out-of-pocket costs to geriatric populations. She endorses telehealth visits to protect the elderly, however, that may be very confusing to the geriatric population. And she's a powerful government leader, and she may not be able to admit mistakes when a plan does not go accordingly. Next slide, please. Solutions and strategies. Preventive management of the aging population requires a multifaceted approach. Access to preventive care programs, patient education, public health campaigns are all essential to success. And it's crucial for providers to give treatment programs and geriatric exams through primary care visits. Next slide, please. Some of the theories that help us overcome these issues are treat theory, transformational theory, and code of ethics are just a few examples of leadership in geriatric healthcare. And with a lack of leadership, we can expect this crisis to rise. That's it.